Hi, this video is mainly for people who suffer from migraine headaches or tension type headaches, dizziness, tinnitus, and all these symptoms that they cannot find solution for other than taking medications. This video is to tell you that maybe there is a way out other than medications. First, I want to tell you why would a tension in your neck or jaw muscles can be contributing to your symptoms. I want you to know that our muscles function together. So if there is tension in one muscle, it will put the pressure on the other muscles. It's like rubber band pushing and pulling from one side and putting more tension on the other side. So if we have tension in our neck muscles in particular, I want you to know that we call them trigger points and we call them referred pain coming from a trigger point. So if you have a knot in some of your neck or shoulder muscles, like these 2 points in particular, can give referral pain that will feel like a headache in the temple region. And if you have trigger points in your sternocleidomastoid muscle, it can refer pain that will feel like headache behind the ear or in this area or in this area or even on the top of the head. So this is what we call referred pain due to trigger points that are coming from another place. And this is not a new knowledge. This is a knowledge that we have books written in all our parts of the body. This concept of referral pain is there and it goes in all different areas. That's why many times you feel pain in one area and you keep treating that area, but the pain doesn't go away because the source of the pain is somewhere else. It's another muscle, another reason. Because of that, I want to tell you that we have tried with patients with headache, and many of the patients with headache and migraine or dizziness or tinnitus that's not going away, to give them a Nightguard or a splint. And as I said in the previous video that I talked in details about the splint, I usually give the splints design based on the type of occlusion that the patient has. Every patient is different. So I give different ones to different people, and we have seen that many patients with headache have reduced their pain and their headache and their need to take medication by using the splint if the cause was because of their bite and their bruxism at night. This will lead to a lot of pressure in the area and will start a headache cycle for them. So once we interrupted that, we interrupted the ability to put that much of pressure on the joint and on the nerves and on the muscles, that headache has gone away. And I know that the headache topic is a big topic. It has multifactorial reasons as well. Like it can be due to food that patient is sensitive to that triggers their migraine. It can be due to high blood pressure and many other systemic reasons. I understand that. But what I want to tell you is that in many patients, a big factor in their headache comes from their bite or from the muscles of the neck. And because of that, if the muscles of the neck are contributing, we usually refer to the physiotherapist to release those muscles and those trigger points. And I have tried it on myself for a while during my journey. I used to have headache that comes in the left side of my face and feels behind my ear. And when I relieved the tension of the sternocleidomastoid muscle with the myofascial release and the physio, my headache used to go away. So no one wants to live on medications because we know medication have side effects on the liver and the kidneys and other parts of the body. So that's why I want you to know that there are other treatment modalities that you can consider. Another thing you can consider if you are a chronic migraine patient is to consider either trigger points, injection, dry needling, or Botox, which again is the idea of it is to release those knots and remove the reason behind your headache. And of course, if you are someone who is always sitting on computers, or you have a bad posture, or you are a dentist like me who have a bad posture because of our position as we are treating the patients, you need to consider to stretch, do stretches, every maybe 1 hour, get up of your office and do those stretches. And you can look up stretches of the neck and shoulder muscles and learn a lot from the internet about how to keep them functional at the normal length, because once they are going into contraction, they will start to have those knots, and those knots will start to refer the headache pain, and you go into the cycle. So learn about stretches for wherever you feel is your knots are, and many times we are not able to find our knots ourselves. So either a massage therapist or a physiotherapist will be at least be able to identify by putting more pressure and scanning the muscle to be able to see where those knots are. So I hope I gave you some useful information here that you can consider, and hopefully you will not need to take a lot of medications and be able to live happily and healthy forever, inshallah.